we've got Dr. Rasool, who's a local GP. Many of you will recognise him. We've got Brother Umar who's come from Blackburn as a paramedic, and we've got Elias, who's a pharmacist as well, and we've got some other clinicians who will come at some point during the course of the session. So without delaying any further, I'll just ask Hafizullah to just do some Quran recitation.
أعوذ بالله من الشيطان الرجيم الأرض فكأنما قتل الناس جميعا ومن أحياها فكأنما أحيا الناس جميعا ولقد جاءتهم رسلنا بالبينات ثم إن كثيرا منهم بعد ذلك في الأرض لمسرفون. Whoever kills a soul unless for a soul or for corruption in the land, it is as if he had slain mankind entirely, and whoever saves one, it is as if he had saved mankind entirely.
So we'll quickly move on because we've got a lot of content to cover today. A few people have asked me as well if they need to leave early. Obviously, it's a session, so if you can drop out if you need to leave for any reason. But to get the certificate, obviously, we need to make sure that participants fill out a quick feedback form at the end, and only then will the certificates be issued. So if you could try and stay to the end, we'll try and be as quick as possible. But if you need to leave, then by all means, feel free to leave. So I've already introduced the team. This is just the basic outline of the session. So we will go through the 4 different things that we're going to cover today, inshallah. So we've got CPR, recovery position, choking and bleeding management, which is new for this year. So this is just a bit of quick background on BIMA, British Islamic Medical Association. Some of you may have heard of them already. A few months ago, before Ramadan, we did a healthy Ramadan event in Jamia Masjid as well. So they basically are a medical organisation made of healthcare professionals across the whole of the UK from different parts, and they specialise in different areas. But they basically get together and try and promote Islamic values, but through the medical profession basically. So they organise various events, some of which I'll introduce to you today. So just some of the events that they do. So they've got national projects. I was just talking about this before to the paramedic Umar about the health at Hajj. So they do a lot of events for the healthcare professionals to upskill them as well, but also for the general public. There's also a lot of debate going on about women professionals having to roll their sleeves up in a hospital environment. So they've done large campaigns throughout the NHS as well to support Muslim clinicians, female clinicians in the work environment. Some of the other things that they do is cancer screening. I know I spoke to Dr. Rasool last time, and he was saying that within this area especially there is a very low rate or turnout rate for Muslims going to get checked and screened for cancer, especially things like bowel cancer, etc. So there's a lot of promotion that needs to be done within our community as well, but also on a national level, and BIMA are obviously promoting this. The Healthy Ramadan event, and as you can see, the Lifesavers event, which I'll go through in a bit more detail. Other things include fasting, diabetes, how to manage medication, etc. And they do other talks and topics online webinars as well. This is for more for healthcare professionals, so they have like a journal as well, where different medical professionals will input into this and to sort of upskill the rest of the members. There's a lot of junior doctor training as well, so from a young age, medical professionals who are going through their undergraduate training, and also when they qualify. And on the sister's side, we've got some junior doctors who are newly qualified in the last couple of years as well, so they're delivering that and now giving back into the community as well. So I'll just hand over to Dr. so we go through some background on why basic life support is important.
Assalamu alaikum. Good to see a good turnout. I was quite surprised, mashallah, because when you had last event, there's only a couple of representatives, but mashallah, you guys take it so seriously now. A lot of people know me. I'm a local GP in Frenchwood and Navenham, and there are a lot of familiar faces to me as well. Because I recognize some of brothers locally. So this is, first of all, thanks. This event wouldn't be possible without the hard work of our brothers, Ilyas Bhai and Muhammad and everybody. So jazakallah to those. So this event is obviously, like the brother said, there's four things we're going to cover, and we're doing first of all basic life support. Does anybody know about first of all, this is then okay, rather than waiting to the end. Does anybody know anything about basic life support? Okay. Anyway, so basically basic life support, as you can see, the picture is kind of self-explanatory. Anybody can, likewise, immediately, the heart stops beating. I mean, that's it, isn't it? And the thing is, the inclination is always that it's not going to happen to me. It's not going to happen to us quickly because our population is growing, we're aging older. But I think that from cardiac important for all of us. Cardiac arrest is a condition. When in the UK, we have a cardiac arrest every year. Everybody will be jumping and say why, but nobody talks about this cardiac arrest, the silent killer. There are many reasons for this, but the purpose of talk today is what to do in case somebody collapses in front of you and the heart stops beating. Ischemic heart disease, as you can see from the graph, the incidence, which is the rate at which it happens, is going up. Ischemic heart disease is a disease where there's blockage in the arteries of the heart, which then leads to the heart to stop beating, which leads to cardiac arrest. As you can see, the ethnic origin in Indian and Pakistani, Bangladeshi, so all the South Indian origin population is extremely high compared to other Caucasian origin. Probably because some factors which will come through. So it says here why Muslims at risk. I think this probably means that Muslim South Asians as well, because obviously Muslims around the world and the background and the living is different. But talking more about our population and Muslim from South Asian population, it's mainly because of the diet, because of smoking, because of life choices, various things. They lead to increased cholesterol, increased ischemic heart disease, for example, any illnesses that lead to clogging of the arteries of the tubes that supply the heart, which then increases the chances of your heart stopping and causing cardiac arrest. Again, smoking is the major risk factor. I think there's two things that the main you could change to reduce is blood pressure control. So if anybody has high blood pressure, controlling high blood pressure is very important, but also smoking cessation. I think last time there was a bus here from one of our brothers who actually delivered smoking cessation as well. So there's oxygen around the body, okay? So if the heart stops beating, the other vital organs will be starved of oxygen, and therefore you can lead to many complications in simply. Yeah, I think yeah. Does anybody know how many cardiac arrests happen in the hospital? No. I mean, the purpose of this point is they only get taken to the hospital. All cardiac arrests will happen in the hospital. 80%, which is a vast majority, will have us to have an idea, be aware, and have some sort of basic training to know what to do in an event if that was to occur. It can happen anywhere. It can happen, like I say, in weddings, in seminars, in functions. It can even happen in the masjid as well. The thing is, masjid, what we don't realize, I mean, we do have a defibrillator masjid, which is very good, but it's one of the most commonly visited communal area. You know, our residents come here 5 times a day, old and young. Therefore, it is important for us to be aware of it as well. And the most important thing is that when anybody has a cardiac arrest, because there's a sudden stop of the blood circulating oxygen around the body, every second counts, and therefore you need to start basic cardiopulmonary resuscitation, CPR, immediately. So we need to ask for help immediately, and if needed, connect a defibrillator. I think there's a defibrillator training as well, and you'll talk about that in more detail. And the time it takes from somebody having a cardiac arrest to starting CPR to connecting a defibrillator is very vital, because the longer it takes, the worse the outcome. Yeah, it says 8 minutes, which is a national target actually. It can take up to 8 minutes for an ambulance to arrive on a good day. That's their target. But brother will know, sometimes when they're busy, getting somewhere in 8 minutes is very, very difficult. And all ambulance calls are triaged as well, and therefore they may not get to they may not get to you. And the important factor in knowing when a cardiac arrest has occurred as well is because the general public will be making the call to the ambulance service, and they need to know okay, and whether their priority list. Because it takes 8 minutes and 20% everything, that's only 1 in 10. 1 in 10 patients have a cardiac arrest, only 1 will survive. Therefore, the outcome is quite bleak. So, would you guys know what to do? The answer is probably no, this is why you're here. Go on. Yes, that's true. Yeah, so that's what you would do. Anybody else know what to do?
We will know.
You'll know after, yeah. Okay. So this is a chain of survival, okay? So what I normally say is that you have to be safe, okay? So safe is like a good acronym. Obviously, brother will go into more detail, but safe is, first of all, when somebody has a cardiac arrest, you need to shout for help. So, hello, can you hear me? Where is it? Look, get some help from somewhere, especially in emergency setting. Approach with care, find out what's happened, assess the situation, what's the scenario, where are we? S, A, F, and E. You need to,
Just
Yeah.
to add it on, in a chain of survival, it means that there are some certain steps you have to take till the patient or the victim arrive to the hospital. And this time actually consuming. So how we can do that safely, and how can assure that that guy is going to survive? So have a certain points of have done them correctly on time, the chance of this person to come back to life is more. So here means ask for help. It's a very thing. So if they ask for help, that chain all will not happen. No one will come and patient is not going to hospital. After the help, you need to do some help like compression, which you're going to know now. The issue is that, as you have explained earlier, about the 10 minutes or 9 minutes target, with the 8 minutes arrival of the ambulance, it means until the ambulance arrives to you, already the 9 minutes has gone, and the patient is dead. So there is no point him to come. You understand? So you need to maintain that 8 minutes more, like 15 minutes, 20 minutes. How we can do that? To act in behalf of the heart by compression. So we give the blood to the brain will just work on, will depend on the oxygen in the blood until help comes. So without your help, that chain is break, it's not going to work. You understand? The other, that one is a defibrillator which you are going to teach you at the end, is one of the vital help to the patient. And delaying it is going also to affect all the chain. Now the ambulance just came. How many you can do for the patient? 1, 2, 3 until number 4 comes. And if you have lost this, there's no point for these guys to come. how do you know that?
Chief tomorrow. Chief of
If you don't,
I'll just
it's
quickly
your school.
just a couple of slides, just let you know that obviously this event is taking place in 4 masajid today in Preston, City Mosque, Masjid Nur and Masjid Salam as well, but it's happening all around the UK. It's 100, yeah, they've had it in loads of masajid across. So as you can see, the numbers are going up slowly every year, inshallah. This is just some of the global locations. So now we'll
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. I didn't introduce myself. My name is Dr. Abdel Monen Al-Hakim. You can call me shortly Monen. I'm one of the consultants in Plastic Hospital. Sorry for interrupting him in between, but I thought it is a valuable information in between to understand what's the importance of coming here today. Because usually when I'm an A&E and they get a patient who are actually out of hospital arrest, I will first question I ask to the paramedics, did he have any bystander CPR immediately after this? No. Then I'm going inside to decide stopping the efforts early. It's not going to help. There's no point to just hurt the body, isn't it? But yes, this started. Then we have completed. Okay, now I'm encouraged to carry on. That's why I came to. I'm sorry about that. What's going to be this today? We're going to speak about CPR, which is a cardiopulmonary resuscitation, or sometimes it is a compression of chest and whatever. Second is recovery position, how we can put a patient in recovery position, and when to decide to do that. If we face the patient who is choking, and we usually do that, we're going to cover that session as well. And if you have seen a patient who is bleeding profusely, what can you do? Okay, and how each one of these sessions is going to run. Each one of the previous 4 sessions is going to run same way. I'm going to operate a video for you. I'm going to visualize it, and more information you'll find in the video. Then I'm going to demonstrate for you what you are supposed to do. And after that, we are going for a small groups to practice it. So we have here 3 Americans, so we can divide 3 groups, and we can practice. And someone of us is going to be next to you, and they will give you the best way to deliver or to do it perfectly. And after the practice, then we can summarize at the end. It is how it's going for each one of them. So now the gentleman, what's your name? Kashif, nice name. Kashif, you have asked me how can I know? Valid question. Patient came unconscious, everyone can understand he is unconscious. You don't need to check it, isn't it? Someone has collapsed in front of you, but he is not breathing. So how can you know he is not breathing? Anyone knows? Yeah. This is a pulse. Okay. Pulse is here. Okay. But it's not a breathing. But it's good point. How can I check the breathing? How is breathing?
this is chest, right?
It's just observe him. Is he breathing or not? Or he is really having a good effort to breathe, because sometimes you do like this. It's the breathing. It's nothing. It's not breathing. So if he hasn't breathing, if he's moving, have you seen the dead body moving? So if he's moving, definitely he's alive. You understand? You put your finger here and you teach you how to get it. If you feel the pulse, he's alive. Is that right? So you check all of that. So how many minutes I need to take or consume to check all of that? Less than 10 seconds. 5 to 10 seconds. So not less than 5, not more than 10. So 10 seconds. So he is unconscious and he is not breathing. Technically, he's dead, isn't it? So heart is not beating. What can I do? We can continue.
It's available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone, so that you can begin CPR as soon as possible. Yes, place one hand center top and up your fingers to lift them off the ribs. Lean over the casually with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, give it a rescue breath in about 1 second. The chest will rise. Remove your mouth from theirs and watch the chest fall. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. Because it starts to show signs of becoming responsive, they start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask the caller to call 999 or 112 for emergency help, and ask them to bring an AED. If you're on your own, make a call yourself, ideally by using a mobile on speakerphone, so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR.
Thank you. So what I'm going to do, I'm going to demonstrate exactly what you are supposed to do at home. He has explained nicely how to do the CPR, but before CPR, some couple of steps you need to do. Shouting for help, recognizing that he is in danger to do, and to who to call, and what you need. So, if you got someone who has collapsed, then gently you can go there, be sure that he is really collapsing. You might be still victims. So just gently.
Just one thing, sorry. Everyone just move forward from what you people
Just okay. So gently. Are you okay? Are you okay? Is he responding? No. So he's unconscious. Now I confirm that he's unconscious. He's not sleeping, isn't it? So he's unconscious. What I'm going to do, I have 10 seconds. What to do in 10 seconds? I have told you early signs of life and obviously breathing. So simultaneously in less than 10 seconds, I will put my hands, my fingers. Do you know Adam Adams? Slide it to the groove. Everyone, go to your Adam Adams. I can't find myself. And go one of the groove here. You'll find a depression, a dip, and there you can feel it. Okay? Try to practice it. Here to feel how pulse, if possible. If not, just look at the patient's chest. Is he moving? In a limb, he is not moving. So for me, at the moment, I'm conscious and he is not breathing. If you are uncertain, good. So I have now a patient who's unconscious and he is not breathing. Please, Mr. X, whatever he is here, I need you to call 999. Ask them we have this situation and we need an automated external defibrillator (AED) to arrive or an help to come. Then you commence the help. Now is the time to do CPR. This all scenario I have explained less than 10 seconds. That's why it is very important to be trained in it. You cannot assume it, you have to be trained in it. Okay, so where to locate? Everyone in his chest, he'll find the middle bone in the chest. Can you feel it? Between the ribs. Can you feel it? Go up. No, in the middle. Just behind the bottoms. Yes, you know the bottom. Yeah, just behind there. You feel it. Come up, you'll find all the bone here. You know the needles. center of the sternum, just below it. So quickly, patient is here, my hand is here. Here's the nipples, my hand is the heel of the hand, not all the hand. The heel of the hand. My second hand is on top, then I can just grab my fingers up to avoid breaking the ribs. So, what I'll do next, I will put my weight over the patient's. This way, come here. All my body is over the patient's. Why? Because I need to use my muscles to push the chest. You cannot maintain it. You will do 1 cycle, 2 cycles, and get up. I feel up. I cannot. But use your body weight and the gravity physics to make it easy for you. So what you'll do, push hard, lock your elbow. Don't bend it. If you bend it, again, you are going to use your muscles. It's not going to work. So lock your elbow and then go push hard and fast. You see, I'm using all the body. I'm moving the trunk. I'm not moving my shoulders, not moving my muscles, only the trunk, going and up and down. So what is the rate? Is about 100 to 120, which is quite fast. So how many I'm going to do? Is 30. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How much I'm going to push down is about 5 to 6 centimeters. So I need to push hard and fast and make it big, deep as much as I can. With hard one, can you imagine hard to contain the blood and need to be pushed up? If you just squeeze it simply, it's going to move up, but it's not going to be pushed. So the blood's not going to go to the brain. I need the brain. So I need to push hard. Okay? So hard and fast. Then I have finished 30. After 30, what should I do? I should give him breathe. It is a bit challenging to give breathe to a dead body who might vomit or whatever. So it is okay if you cannot do that. Carry on chest compression alone is clearly recognized by British and American guidelines to do that as bystander, lay person. But if you can give a breath after 30 compression, give 2 breath with the same way. Just put your hand on the forehead, clench the nose. You need to obstruct it. Push the head back. Now you are opening the airway, which is called head tilt chin lift. Then seal your mouth around his mouth, and then push your air over 1 second. And you need to see if the chest is rising or not. So you can do that. It is rising?
Yeah.
Yes, because I'm looking. So when I leave it, the chest normally goes back, air comes out, then I can give the next one. Then back to the compression. Then your chest of giving 2 breaths, not more than 10 seconds. It is the maximum allowed period to lose or to be off the chest. You need to be on chest all the time. So 10 seconds to give the 2 breaths. If you struggle to give them, back to chest compression, either whatever the breath or not. Then you go for again chest compression. Of course, if there's someone with you at home, after calling the head, you can swap because it's tiring, then you can swap over. You can do second compression, you can help everything and so on.
What's the purpose of getting or bringing it inside his mouth?
Okay. The purpose, you normally to live, you need your heart to beat and your lung to get air, you breathe. And the air comes in and the oxygen going to be exchanged with the blood and to make the blood always having oxygen for better oxygenation for the brain. So chest compression again alone without giving breathe makes the blood lack of oxygen. So giving a breathe is going to make the blood having more oxygen, allowing more oxygen to go to the brain. But if we're not able to deliver it, that's okay, we can carry on. Even so, theoretically, if you are pushing, releasing, lungs collapse and inflates, it takes air. But it's not proper breathe. So it works at the time, it works. Okay? Yes.
Why only 3 breaths?
Why only 2 breaths? The aim is to minimize the interruption between the compressions. Because it's a long story. In 2000, approximately, it was about 5 to 1. And they found by the studies that 5 to 1 makes lots of interruptions. And the outcome is poor. Then they have changed to 15 to 2. And again, the studies showed that less compression and more oxygen. Then they have shifted to 30 to 2. And now they are declining the 2 in layperson. The most important is make the heart work as much as you can. The problem is that if you start going compression until you get the peak of the real good compression, you will consume 3, 4, 5 compressions until get good compression. And the last 2, 3, because you are tired and you know that you are going to stop it soon, is going to be weak as well. So at the end of the life, you'll find about 20 good compression in between. And we don't like the interruption to be more than this. Yes,
If we breathe out carbon dioxide, how's oxygen going to breathe?
I like you. It's very good. Okay. Our oxygen, the atmosphere has a specific percentage of CO2. And that specific I don't like to give the figures, but that's fine for you. A specific percentage of CO2 and a specific percentage of oxygen and some other gases. When you breathe in, CO2 builds up, oxygen goes to your blood, and then you exhale the air with more CO2, but it's not significantly high. So it is high CO2 content, I understand, but not significantly high, and still have a good oxygen. And to think about it, do you have any alternative solution? No. So it is not the alternative solution, but the answer is that there's no global difference. But if you breathe in a bag, after 5, 6, 7 breaths, if you're going to consume the all oxygen, you will feel bad. But not from the first breath. It means you contain some good oxygen when you exhale the breath. Hope it's answered the question, but I like you. How old are you? How old?
13.
Oh, okay. What good question? Any more questions?
What happens if the person wakes up while they're doing the CPR?
It's a next session, recovery position. So if you bear with us until you get trained of that, you will go for the recovery position. Either he came back or he is from the start. I checked his breathing, he is breathing. So both scenarios work with the next is the recovery position.
So say for example, say he does wake up and then you think I'm going to put him in a recovery position, but then he collapses again. What do you do in that situation?
Again, you need to start again.
Right.
Same way. Check his really collapsed, then
No, I was saying
just
go to
that.
the-
Okay.
We'll just break out to
Yeah.
I know they're a very good question. There's two things. Everybody asked a very good question. Yeah, one of you asked why the compression is more important. Because there's blood in the body already that's been oxygenated. So if you start on compression, at least will circulate that blood that can be oxygen. Okay? And the second thing is the main purpose of the pressure, like the doctor said, is to act as on behalf of the heart. Okay? So you're actually pumping the heart in itself by yourself with your mechanical pushing, right? See, if you stop doing that, then there's no point having oxygen there when it's not going to be circulated. So the most important thing, yes, giving oxygen is important, but the pumping is more important than that.
Yeah. I think the main point is good. The main point, you are working in behalf of the heart or brain, depends only on glucose and on oxygen, nothing more. So any other organ has another alternative way to survive, like going for anaerobic. Have you got an anaerobic breathing? So sometimes goes to anaerobic breathing and survive for some time, maybe quite few hours. But brain does not have this ability. You need only fresh glucose, even not any other form of complicated carbohydrates. Only free glucose and oxygen without those diabetes. If he's having hypoglycemia and blood sugar, what should happen to him? He'll just lose his consciousness immediately. And when you give him the glucose, like a magic will occur, like magic. So because he can't understand how to utilize anything more than glucose. Same way with oxygen. That's why I need to survive him. If the oxygen lack to any other organ, patient can live with it. Someone can live without hand, yes. If without leg, yes. But if brain dead, done. We are done. So I need to survive it. And only brain can live less than 10 minutes without oxygen after that death. That's why it is valuable. Okay? Okay, now we're going to be divided in groups. And we have 3 mannequins, and then we'll supervise you while doing that and show you how to do it as better as we Is that all right?
If,
Thank you very much.
A few people